So we are gathered here today. I'm Donna Cooper. I'm the Executive Director at Children First. And every 2 years, we try to do an update on the status of children in each of the 5 counties. And we're a little bit late in doing this because we've been waiting for data to come out to really tell us what the 2-year period that we're talking about here has meant in the lives of children. And as you know, most of that 2-year period was impacted by COVID. But what we're really looking at is what happened to kids in the period of COVID, because the last reports that we put out were right before COVID shut down. So what we're gathered here to talk about today is about children in Montgomery County post-pandemic. So what was the impact of COVID and what do we see moving forward? And this is the first release of this data, so we're really grateful that you're here to hear it. Now, one of the big things that happened, and I'm briefly going to go over this in kind of rapid speed, and then ask Emma the student, and Emma, the Montgomery County official, to speak very briefly afterwards, so that, Evan, you have some context locally in addition to our research, and then take questions. So one of the most surprising things, and this happened in every one of the 5 counties, is that child poverty dropped during COVID. Now, that's kind of hard to wrap your head around, since I think about 53,000 families, people in Montgomery County lost their jobs during COVID. So like, how did child poverty drop when people's income dropped? And actually, one of the biggest takeaways that we learned during COVID is that good public policy works. And the good public policy in this case was the creation of the child tax credit and the extraordinary federal efforts that went on to keep people having income during COVID. But this drop in poverty, because lots of income support went to people during COVID, this drop in poverty for kids is really because of the child tax credit. Child poverty in Montgomery County dropped by 15%. And that's a good thing. And it shows we can do it. Now, the second thing we know is that in addition to child tax credit benefiting 50,000 families, what you can see here is that Medicaid and SNAP also grew during COVID, and the federal government put great flexibility in place so that children wouldn't go hungry, families wouldn't go hungry, and that children's healthcare needs would be met. And what you can see is that another 10,000 kids enrolled in Medicaid in Montgomery County, actually 10,600, and nearly 22,000 families actually benefited from families with children. So these were an expansion in federal benefits, and the child tax credit also expanded. And as a result, we really saw that children were very well protected, not just from the virus, but from the impact of the economic shutdown. And both of these things are currently at risk. The federal government will soon be rolling back the Medicaid flexibility, probably in January. And in Pennsylvania, 200,000 Medicaid recipients, including children, mostly children, may no longer be on the Medicaid rolls as a result of going back to the normal operation of Medicaid. And what we already know is that the US Senate has failed to reach agreement to extend the child tax credit that had such a big impact on poverty. They have failed to do that. So we're likely to see in the next year, child poverty could rise if the US Senate doesn't act to extend the child tax credit. Now, one of the things that's really unique about Montgomery County, I will say, and this is very important to understand, is among the 5 counties, Montgomery County really stepped up in very big ways to mitigate the impact of COVID on children beyond the federal policy level. So, you know, they got American Rescue Act and CARES funds. And with those funds, the counties, first of all, put $12 million into the childcare sector to keep the childcare programs operating and continue to make it affordable for families to go to work. They put $15 million into the schools long before the federal funds had hit the street to enable schools to roll out remote learning supports and laptops and hotspots and things like that were needed for kids. So Montgomery County acted quickly, and I really want to commend the county commissioners They reached out to us. They said, how do you think we should help children? And they met regularly with school districts and childcare centers and social service agencies, putting the needs of kids first. And I will say that was a unique and really surgical focus of the county. And also they understood, and I will say it is likely due to the fact that you have a doctor as the chair of your county commissioners, they understood that vaccination wasn't going to be easy, and that a lot of the work to get people vaccinated was going to have to fall on the county to get those messages out. 19 town halls were set up, multilingual, to help families understand the importance of adults getting vaccinated and kids. And that's pretty unique among the counties. And so kudos to Montgomery County for that. Now, what we know is about 2,400 adults perished. So in spite of everybody's best efforts, children in Montgomery County lost grandparents, uncles, aunts, parents, and older siblings, right? So there nevertheless was, considerable grieving and mourning that continues to go on in families in Montgomery County for this extraordinary loss of lives. And in Montgomery County, what you can see, and it again stands out, is that most of your COVID deaths were in relatively near proportion to the share of Black and white families in the county. Other counties had much greater disparity in terms of the racial disparity of how COVID hit them. But what we know is that kids in Montgomery County weren't feeling so great mentally during the COVID crisis. In fact, the state runs, and Evan, I think you're familiar with this, the Safe to Say call line. Now, this is a very small call line. Millions of people do not call it. It is not well known. And that any children call it is always a surprise to me, and most kids hear about it in their schools. But what we know is that calls for kids who were worried about committing suicide and worried about self-harm, cutting, and other horrible ways of expressing the stress and anxiety we feel, they really spiked during COVID. So across the state, the calls went up by 18% for suicide and self-harm. But those calls coming from kids in Montgomery County in that period went up by 103%. And some of it is probably because the parents lost their lives and their jobs or family members, but some of it was just the stress of schools being closed, being home, the stress of the COVID pandemic. And, one of the things in mental health research is the length of your mental distress is typically the length it takes to get healthy. It's not like overnight these kids are all going to feel better. We also learned that parents in Montgomery County did, and probably this is in result to the great work that the county did to get the word out, nearly twice the number of parents in Montgomery got their kids vaccinated than parents across the state. So, it shows that parents in Montgomery County listened to the public health messages at a greater rate than their Pennsylvania colleagues across the state. And so they really responded. But what we also know is that there's 200,000 kids in Montco still to be vaccinated. Most of them are white kids in Montco. And so what you can see is 31% of white kids are unvaccinated, and they account for nearly all of the unvaccinated kids in Montgomery County. So while there's still 37% of Black kids in Montgomery County, because there's such a small share of the population, we still have many, many more white kids that we got to get the message out to. But Asian, Black, and Hispanic kids are also still not vaccinated at high enough rates. So that's sort of the health snapshot. Now, we also know that one of the things that's happening in Montgomery County, probably more pronounced there than elsewhere, I want to raise, is that 2,600 kids started school in the school year last September, 2021, with provisional inoculation. So 2,600 parents did not have their kids' full inoculations in place, not related to COVID. When they started school, a 250% increase from the last year where this data was somewhat accurate, which was 2018, when the school before COVID hit. And so what that says to us is the anti-vax message has had a real impact on families in Montgomery County. And the county and public health officials are going to have to do a lot of work to remind people that parents that polio, mumps, measles, These are critical inoculations that children have to have so that our schools are safe for every child to attend. We also know that there are 1,000 fewer children enrolled in childcare today than there was pre-pandemic. And I want to make sure that you know that there's also significantly fewer people working in the childcare sector. I'm looking for a piece of paper where I printed out that number. I apologize, but if I remember correctly, there's about 5,300 fewer childcare workers because so many childcare centers in the county have had to close. County put out money to keep centers afloat. The state did well, but nevertheless, because of the shortage of childcare workers, because childcare doesn't pay enough for people to go back to work to, we have 1,000 fewer childcare staff, childcare kids in childcare, many programs closed, many fewer staff, and as a result, there's less access to childcare. And that's driven in large part because look at what's happened in your childcare wages. In the period of pre-pandemic to now, the gap between just a retail job at, like any Monco big box store and childcare has not just stayed the same, it's gotten a little bit wider from basically June 2021 to September 21. And so you're basically, if you go to childcare versus a retail store, you're losing 32% of your wages. That's why there's fewer people working in childcare. That's why there's fewer childcare centers open and fewer childcare classrooms. And it's why you have 1,000 fewer kids in childcare. And that means that those parents are having a very hard time working. Finally, I just want to point out that what we know in Montgomery County is that our schools weren't doing so great before COVID hit. 35% of the kids in the county weren't reading and doing math at grade level pre-pandemic. And now what we see is that we just want to remind you that the very schools that stayed closed the longest tended to be the schools where kids were affected by poverty. Norristown and Pottstown on the far right end of this screen, they were the schools that had opened last. They had the least resources to support their kids during COVID, and they have the highest rate of poverty in the county. So they were also the schools where more kids were struggling to test at grade level. So you have kids who started behind before COVID, high poverty rate kept the school from having enough resources to open or do remote learning during COVID. And as a result, those kids are hitting a double whammy in terms of their academic achievement. And again, one of the things that this shows is just from Lower Merion to Upper Perk, there's about a $173,000 gap per classroom in the county. And take Pottstown. Pottstown's got about $10,700 to educate its kids. Lower Merion has about $18,000. So as we're rebuilding from COVID, we're seeing that we have an enormous teacher shortage. And we point out the teacher shortage, and it's not just teachers, counselors, nurses, school personnel shortage in every county. And it makes it hardest for the districts with the least resources to compete for those few staff because they have the least ability to raise their wages, to get the staff that are needed to not only rebound from what we know is the academic challenges pre-COVID, but really help kids catch up since COVID. And so we think that there are 5 things that the county needs to do now. One, I said Monco did a great job. We think they need to write down everything they did, create a handbook so that they are ready to go if there is another public health emergency. What were the lessons learned from what they did and didn't do? And then create a structure that's permanent in the county that really makes it clear that they can proactively address the needs of children in the next public health crisis. And they can do that with an increasing focus on equity. So we just think we should not wait to figure out what we learned from this go around. The second thing is that we need, obviously, the state to step up. And really, the state really put $1.1 billion on the table. And Evan knows this well. A lot of money went out to our schools as a result of the last budget. And that's really great. And the schools got COVID relief from the federal government. So now really the question is, What are we making sure is happening in Montgomery County with those schools to use those funds well? And how do we make sure that the base of school funding that they receive this year is built upon in the years ahead so our students can catch up? We can talk about that more deeply if you want. We also know that there are real mental health challenges. We talked to you about the Safe to Say helpline. It's a small helpline with very troubling data that we saw. But we really need all of our counties and the state to work together to really make sure our kids can get mental health services in schools. They're still feeling that anxiety. They're still suffering from deaths in their community. They're still worried about the fact that they're too far behind. And we need to make sure that we are proactively putting in place a vehicle by which children can get these mental health services and light touch mental health supports in school. We need to curb the impact of inflation. Inflation, we know, is taking a big bite out of families. With fewer childcare programs, with fewer childcare classrooms, childcare costs more. It was $10,000 for a 3 or 4-year-old before COVID. It's probably higher now. Washington can act on this. The US Senate is basically in a stalemate over a $370 billion increase for childcare. If that money was released, our childcare programs could afford to pay their staff more. They would thereby making childcare more affordable for families. They wouldn't have to pass on all of the increased cost of staffing to families. And lastly, we need to make sure that we don't end up with more kids being in poverty. Before COVID, a quarter of the families in Montgomery County were underwater, according to our last report in 2018. Now, we had really good news crazily during COVID, where we dropped the child poverty rate and more families had more liquidity. But we need to make sure now that everybody's back to work in Montgomery County, now that all the businesses have rebounded, we need to make sure that these kids don't fall back into poverty by moving backwards in the federal policy as it relates to the child tax credit. So this is sort of our brief description of what's in the report. And Evan, I know you have the report, COVID's impact on children in Montgomery County. I want to ask my friend Emma from the school district in Norristown, if she could share with us how it felt during going to school during COVID and like how students are feeling now, and whether what I was sharing about the experience of students resonates with what you and your fellow students felt. So hi, Emma, I'm going to turn it over to you.
Well, first, going to school during the pandemic was really scary because, like, in my school, it's like we're not really strict with like wearing masks and stuff. You know, to this year, it's like optional to wear a mask. On the first day of school, I didn't see a lot of students wearing masks, so I just had to take mine off. And that idea, and I got COVID last week.
Oh,
Okay.
wow.
I was really sick, and I've been in quarantine since Monday for 5 days. It wasn't fun. So yeah, I should wear a mask for safety, just for safety. But I think Norristown should like be strict on students wearing masks because I saw a lot of students not wearing masks.
And Emma, how are people feeling about when the school was closed and they're learning? Like, did people feel like they're catching up yet? I mean, what's the sense on the ground?
Well, I think that going to school in person or going to school offline, they both have like really stressful factors. For some, it might be self-isolation and handling the class by yourself without your peers, or handling school in person without having any friends in your class for 3 hours.
Mm-hmm. Yeah. Wow. So did that feel pretty heavy to you?
Yeah, especially like online virtual learning. That's hard because like it's harder to keep up with schoolwork. I think I prefer learning in a class with my friends and stuff. It's a lot better.
And do you feel like now that school started as a regular school year, there are kids who are worried about like how much they didn't get, or are you feeling like people are, sort of caught up?
It's different for a lot of people. For me, I feel caught up, but 2 years of just doing virtual learning, we would be 2 years, a couple of years ahead if this hadn't happened. But one thing that the pandemic taught me is that I cannot predict or expect what's going to happen in the future. So, yeah.
Wow. So there's two things that really struck me about what you said about how scary it is to go to school and how scary it was to go to school, and that you can't predict things. These are entirely new emotions that kids didn't have to have as an everyday experience before COVID. So I really appreciate you saying that. That's a lot. Yeah.
Mm-hmm.
We'll come back to you, but I want to ask the other Emma. I'm so glad these two Emmas have met each other. So Emma from the Montgomery Recovery Office, when you think about now, it was a lot to go through, and I really respect everybody in government and how hard they worked during COVID, and really Montgomery County did a really, look, you were like the first place to shut down. You were almost ground zero for Pennsylvania. So I just think about that now and wonder what your thoughts are about what the county needs to do to continue to ensure children recover, and next steps for you. And I know you put out the recovery planning tool, and people have applied for resources, and you're going to get those resources out. But in terms of the everyday operation of government, what do you think are your next steps?
A great question. I think a lot of it comes down to what Emma had spoken to around restoring a sense of normalcy in ways that we can. And so, as an example, through American Rescue Plan Act funds, we had really been identifying behavioral health care in school districts as one primary place where we can do that. At the same time, we recognize that while the county plays a role in that, it's really up to, or I think I should say, individual school districts have their own set of resources, have their own needs and ideas around what is needed within their own particular school system. And so, as you mentioned, our funding has been allocated for that. But at this point, what we hope to do is have our Office of Mental Health actually provide technical assistance to the school districts in terms of identifying what each school district needs and structuring grant services to support that. Again, recognizing that schools have different resources and that we can't have a blanket approach to say every school district gets the same amount of funding. Some school districts definitely have more need, have more students, have lesser resources available to them. And our intention is for that grant program to be more supportive to the school districts that have lesser resources currently. To begin, not to make up the gap, I don't think we can do that through this funding source, but to begin to have some equity in that funding distribution. I think the other component that you had spoken to is around childcare. And, it's such an interesting topic and such a complex one to address, because on the one hand, we have childcare operators that want to be raising wages and want to be providing a livable wage employment opportunity for folks in that industry. But at the same time, it's a sector where those costs then get directly passed on to parents. And we have known for a long time now that the number of families needing a subsidy far exceeds the amount of subsidies that are actually available for childcare centers. And so one of the projects that we have supported is essentially a study or convening to look at this issue from the nuanced and complex manner in which it needs to be reviewed. And so our intention here is to bring together partners like Children First, as well as childcare operators, early childhood educators, parents and families themselves, groups like Head Start and the IU, to discuss this issue and begin to think about more sustainable solutions for improving this issue long term, which likely would include, policy fixes as well as funding fixes, as you mentioned. So I think, the reality is that the problems that we're seeing now are the result of longstanding community disinvestment, and that there is no quick fix. There is no single funding formula that's going to address any of these issues. with one touch. And so it's really about making those long-term investments to be able to really think about the structural changes that we need to make.
Thanks, Emma. You know, one of the things that strikes me is that it seems that Montgomery County has sort of stepped beyond the traditional boundaries of county government to really think about childcare, which is not a county, you know, obligation, schools, and the IUs, which is not a county obligation. And I do think that what we saw in COVID is that thinking drove a lot of your planning, and it was unique among the 5 counties. That, you know, Delaware County, Chester, Bucks, Philly, everybody, you know, did the best they could. But it is the case that the thinking of the Montgomery County commissioners as understanding the ecosystem of what our kids live in and what our families live in goes beyond the traditional government boundaries. So we really encourage as Children First for you guys to, you know that we think that's a great idea, but also we hope that we can be all thinking at the municipal level, whether it's the other counties, that this is part and parcel of a county success, because it keeps your safety net costs down, the degree to which everybody's doing better. So I think with that, we want to see whether Evan has any questions, right, Amy? Evan?
Yes, thank you. My first question is for Emma of Montco, as opposed to Emma of Norristown. And you had mentioned helping school districts with grant resources to help with mental health. Are those county grants, or is that the county helping the school districts get state, federal, and nonprofit grants?
The grant program that I referenced has already been allocated. It's $5 million that was made available through American Rescue Plan Act funds for every single school district in Montgomery County. And so we have not actually made those allocations to the districts yet. So at this point, what our Office of Mental Health is doing is determining an allocation formula so that the funding can be distributed to the school districts. So it's federal funding that was passed through the county level being made available to every district in the county.
And so that assistance then would take the form of helping school districts understand what they're eligible for and how to apply to get the most out of that.
Exactly. And I believe it would also include things like having mental health professionals at the county look at the suite of services that are currently available within the district, and then also kind of bringing in best practices in the field to help them structure the most pertinent kinds of services that would be most impactful for the students in the district.
What's the timeline on that distribution?
In the fall, we're going to be working on getting that grant information up and available to school districts, but I don't have more details on that at this time.
Well, obviously you can't distribute it until you come up with a formula.
I'm sorry, I didn't hear that.
Obviously you can't distribute any grants until you have finalized the formula to determine how to allocate it and what qualifications are. So that's what I'm asking. What's the timeline on that process being?
I can check on that and get back to you. I don't know specifically.
Okay. Donna, I have a question for you, I think, or at least a question from the presentation. There was, on one of the slides, there was, again, in the mental health category, there was one of the slides that talked about insurance companies covering the full range of mental health issues. And I'm curious if we could delve into that a little bit more in terms of, you know, can you give me an example of something that might not be covered that someone might expect to be covered?
Yes. First of all, let me correct the record. There's 580 childcare workers no longer working in the childcare sector. I think I said a much bigger number. It's 580. Okay. Right now, for instance, we have some school districts in Montgomery County, school districts in other counties who are identifying children who have relatively intense behavioral health needs. And if they're on Medicaid, those needs are being covered. If they are on private insurance, likelihood they're being rejected for the services that they need. And so people call us, parents call us every day, asking to have their kid enrolled in Medicaid so that their behavioral health needs can be met. So one of the things we have in Pennsylvania, and it's not unique to PA, but Pennsylvania has a relatively weak regulation of private health insurance. And when it comes to provide, so that's one thing. Second thing is that Medicaid and CHIP will provide for services to kids with a diagnosis. But Emma talked about, in her school, there might be kids who are just feeling lots of stress, lots of anxiety. They aren't like depressed or psychotic or paranoid schizophrenic. They're kids who need counseling. And that level of counseling is not available through Medicaid or CHIP right now. So kids who a middle-class family might be able to pay out of pocket to go see a counselor 3 or 4 or 5 times, Medicaid currently won't cover that cost. So that's another example of where the system, even the public health insurance system, is very narrow in its analysis of what it will pay for through the Medicaid or CHIP reimbursement system. Does that answer your question? Is that what you were looking for, Evan?
It answers my question, and it also highlights what is, I'm sure, going to be a growing problem. If there was a huge increase in the number of kids calling the helpline, they're likely not calling because they're paranoid schizophrenic. They're calling because they are experiencing all of the stress and the anxiety that you described. So they're going to call a self-help line, and then they're going to find out they can't get that help. Because
those kids, however, I will say for kids who call who are attempting suicide or self-harm, they're expedited into the system and they're paid for. Like if it's a child is at risk of harming themselves, in fact, the private insurers, the hospitals, and Medicaid all cover. Now, the safe to say calls, Evan, I should send them to you in general, went up for general anxiety, depression, kids feeling blue and sad, kids being anxious. They are the kids for which Medicaid, CHIP, and the private insurers are certainly not willing to cover right now. But I did want to clarify that if you're a kid that's saying, I'm going to commit suicide, you're getting paid for right away.
I understand, but that's waiting until the problem becomes extreme.
Exactly.
So, and the largest proportion of children calling of that increase is likely to be all of the students who are experiencing symptoms that come before you reach that crisis.
Absolutely.
And so
basically, we do not have a mental health system that's functioning for children or teens in Pennsylvania.
And so don't you drive those children closer to that crisis point by saying, call here if you need help? So the kid's feeling blue, calls, says, I need help, and they say, I'm sorry, I can't help you because it's not designed to do that. How is that helpful to their mental state?
It's not, I think it's really what happens is that kid gets referred to a crisis hotline. Crisis hotline person will talk with their school counselor. Their school counselor might say, I'll find that kid. Emma goes to a high school. I don't know what the ratio is of counselors to students. Maybe they'll find that kid. They'll email the kids some self-help resources. If it's a middle-class family, they'll email them opportunities where they can find somebody who will see that child. The kind of resources that Emma's guys, or the county's thinking of putting out, are the beginning of building a platform for behavioral health services in our school. Delaware County's looking at the same thing. Philly has been building one, but you're hitting the nail on the head, Evan. We currently have a system where kids can call for help, but a lot of kids don't get it.
Emma from Norristown, can I ask you a question?
Yeah, go ahead.
Okay, great, thanks. Thank you for doing this. I always find when journalists and adults and specialists talk about things that affect kids, we very rarely get to hear from the kids about what their experience is. So can you tell me, when you said you had some difficulty learning from home and that you felt a little bit isolated.
Yeah.
Did you feel isolated enough that you wanted to reach out to any of the school counselors to talk to them about that?
Oh yeah, I did in middle school.
Okay.
I must know. Counseling, like in Norristown, I don't think a lot of students reach out to the counselors as much, like in middle school.
Oh.
Like to talk about problems that they're having. There's Gear Up. They can help you with tutoring and stuff, but no, not a lot of like students talk to the counselors about like,
And how they feel.
yeah, how they feel.
Did you?
I think you know, Evan, we have a misnomer in the term school counselor because they're really like your college access people.
Yeah.
But we have the term counselor, so people think that that's what they're there for, but they're overwhelmed with their, the number of kids they got to get
Right.
the paperwork in for. Yeah.
Well, that's what I'm trying to
Yeah.
get to and find out from Emma is whether or not if you felt sad or isolated, were you able to get any help from anyone?
Emma, do you think kids would know where to go if they were just feeling really blue and needed to talk to somebody other than a friend?
They would have a family member to talk to. That's what I do sometimes. Talk to my family.
Did any of your friends feel badly? Did you talk to your friends about sharing the same experience of feeling isolated and that sort of thing?
Some things are like a little too personal to talk about to my friends, so
Okay, and I certainly understand if you don't want to talk to a newspaper reporter about it. I'm not trying to embarrass you or do anything like that. I'm asking you if you're willing to a certain extent to be a voice for the students that go to school.
sorry, could you repeat that? I'm sorry.
Yeah, I'm not trying to embarrass you or to put anything in the.
Oh no, you're not me.
Okay. I'm just trying to find out if you were able to get any help, to get help that you needed from your school district.
Yeah,
Okay.
there are certain adults in the building that I trust that I can talk to.
Okay. And how were you able to reach them if you were home? Would you call them on the phone or?
I would email them.
Okay. And would they call you back or was it an email?
Yeah, they might not answer right back because they get like 30 emails a day by different students.
But did you feel that people were responsive to you, Emma? Like you were lucky then to have a school where people were able to respond to you. Did you feel people responded?
Yeah,
It's good to hear.
Okay. You said you're a freshman now?
I'm a sophomore.
You're a sophomore. All right. I don't have any more questions for you, Emma. Thank you very much for answering.
Well, thank you very much for Emma. And Emma, thank you very much. Evan, thanks for being here today.